We'll discuss yet on another drug, and this drug is known as what? Piperazine. All right. So we'll be talking about the pharmacology of this drug, and whenever we're talking about the pharmacology of any drug, we always bring a lot of pictures so that you guys will basically what? Visualize them and get to see how these drugs look like. All right. Then we'll talk about the mechanism of action, the uses, the pharmacokinetics, the clinical application, the side effects of these drugs. Okay. The contraindications, that's when you shouldn't use these drugs. Then the possible interactions that these drugs could have, all right, with other drugs if they are taken together. So this piperazine is actually what? A pharmacological agent that has various clinical applications. Okay, so when it's saying various clinical application, it can be used to what? Tackle a lot of what? Problems in the body. Okay, so here is the overview of its pharmacology. Its mechanism of action now, it has an anti-helminthic action. When you see anti-helminthic, that's simply what? Against worms, which could be parasites, right? So piperazine works by paralyzing what? The worms. Okay, paralyzing the parasites such as what? Worms, and preventing them from absorbing the nutrient, because these worms actually get into you and they could be in the intestine, so as you are eating, they are absorbing the nutrients. So it's just like they are working for another group of organisms, okay? So it acts by paralyzing them, okay? It's like throwing them into a stroke state, okay? It has antihistamine effect. So piperazine has antihistamine properties which could help to alleviate the symptoms of allergies in the body. It has antipsychotic effect. So piperazine has been used as an antipsychotic agent, particularly in the treatment of disease conditions like what? Schizophrenia, right? Then pharmacokinetics, absorption. Piperazine is well absorbed orally. Distribution is widely distributed throughout the body. Metabolism is metabolized in the liver. Excretion, if you want to excrete this drug, is through the urine. Okay. Clinical application, it is used for what? Parasitic infections like what? Pinworms and roundworms. Um, Allergic reactions from itching and hives. Psychiatric disorders, you can use it to treat things like what? Schizophrenia and anxiety. Okay. Side effects, this drug could cause gastrointestinal upset, okay, because it's tackling a lot of things, so it definitely has a side effect. Because dizziness, cause headache in the individual, cause fatigue, can also cause some allergic reactions, which is very rare. Okay, the contraindications, that's where you shouldn't use this drug. There's a known what? Hypersensitivity to, if there's a known hypersensitivity, if the patient has a history of reacting to this drug, don't use it. If the patient has some other underlying liver disease or kidney disease, don't use it. If the patient is pregnant or currently breastfeeding, don't use this drug. Okay. Then interactions, can interact with what? Antacid, CNS depressant, and the MAOIs. Okay. So that's it for what? The pharmacology of this drug, piperazine.